Hi, I'm Yasmin, a wife and a proud new mom with a background in perinatal nursing. Welcome to Birth Unboxed, where we talk about all things birth, whether it's unassisted free birth, home birth with a midwife, or in a hospital. I believe every woman deserves the right to choose how and where she gives birth. I created this podcast to raise awareness so women can make informed choices and feel empowered in their births. By sharing stories and learning from one another, we can reclaim our power and become the ultimate authority in our own birthing experiences. Sisterhood is powerful, and I am so glad you're here. Let's get started. Hi, Nicole. Thank you for joining me today on the Birth Unboxed podcast. I'm excited to hear your stories. You have 2 C-sections.
Yes.
And 2 high-risk pregnancies.
Yes.
So I think it's very important we have conversations about these truly high-risk pregnancies and how essential and how lucky we are to have access to hospitals and the care when we really need it. And your story definitely sounds like one of those times. So
Yes.
yeah,
Yes.
so let's get into it. Like, start from the very beginning. Let us know
Yeah.
how everything unrolled for you.
So with my first pregnancy, so I had a girl. It was around, so to add a backstory to it, I was lucky enough to be pregnant with a lot of my girlfriends. So I had other pregnant women around me so I could compare. So when I was about, it was like 25, 26 weeks, it was just after the diabetes test. I had to have a follow up with my midwife at the time. And I had expressed concern that I was really small. Like you couldn't tell I was pregnant. And I was honest in my sorry.
It's okay.
I was almost in my third trimester. And I said, I was like, I can't even see that I'm pregnant. Like all of my other friends who are, like, you can kind of see like what's going on. And it was also during COVID. So I wasn't really, not all appointments were in person. So some
Right.
were on the phone. So I wasn't seen as often.
Yeah.
When I sit on my lap. Okay. Um, so I had gone in one day. Yes, it was after the gestational diabetes test, and she did look at me and she goes, you are quite small. Like if I saw you, yeah, I wouldn't be able to tell that you're pregnant." So I said, "Okay." So they asked me to come in a little bit more regularly. They asked me also to just I had barely gained any weight. I can't tell you the exact number because I don't remember, but it was nothing close to what I was supposed to be at. And they were like, "Okay, let's just try eating a little bit more. We'll monitor you." And they had sent me off for extra ultrasounds to be done just to make sure. So when they would measure from the pelvic bone up to my belly button, I was measuring 3 weeks behind. But one of my girlfriends was actually due 3 or 4 weeks behind me, and she was bigger. So still, but my midwife had explained that, some women carry differently and all of that.
Yeah.
So I wasn't worried yet. And then it was at one appointment so all of my ultrasounds were at like a community ultrasound center. And I also didn't realize that community ultrasounds are different, like your regular clinic ones are different than a hospital one. So that's what I learned throughout this pregnancy. So I was sent to one of those at 30 weeks. I was 30 weeks. And because this was kind of so 2-3 weeks after the test where they realized and they kind of kept an eye on me and they sent me. And so, of course, the ultrasound tech said, "Oh, like your OB will call you for a follow-up," which she did like right away after because the ultrasound tech must have realized what she did and had messaged my midwife right away. And she goes, "Something's not right." So as soon as I got home, my midwife called me. She's like, "You got to get yourself to McMaster," which is where I had both of my children. She's like, "You got to go to Mac. You have to go to the L&D department there, and you have to go for an ultrasound so you can get a little bit more information."
And this
of
was
course,
around 30 weeks?
yes,
Okay.
this was at 30
Yeah.
weeks. So of course, like terrifying.
But before this point, the ultrasound you had previously done, they were coming up normal?
Yes, because I only
Okay.
had the anatomy scan before this.
And the anatomy scan was fine? Yeah.
Other than that, my daughter wouldn't let me see anything, so I had to have 3 because maybe because she was also smaller. They never really raised concern about that. But they were fine. I just had to go back a few times because they couldn't get everything in her heart.
Okay.
And so they realized, so that we went to Mac and it took forever, but they realized, I guess they must have done a special one on my umbilical cord. And they told me that my umbilical cord was, one of the arteries wasn't working. So because of that, my daughter was lacking nutrients and she was measuring like way behind. So then they
Mm.
also told me that she was breached and that I would have to have a C-section, which I quickly said, no, no, like she'll flip. To which the OB replied, no, no, you have no amniotic fluid. This girl
Mm.
is not going to come out on her own. She needs to be taken out. So they also told me at that point that I would have to have her earlier. I couldn't have her in further than 37 weeks just because then it would be dangerous for her. And that, like, I was told to prepare to have her in the NICU most likely. So it kind
Mm-hmm.
of depend on when what her situation was when she was born. But I did have it in my mind that she would be in the NICU, which was nice to be prepared to know.
Yes, for sure.
So I
Yeah.
knew that like I probably wouldn't take my baby home right away. And they kind of just warned me that, we're not sure. Like they never said anything about like cognitive or anything. Like they weren't ever
Mm-hmm.
worried about her development. It was just that she was small. They just told me she's
Okay.
probably gonna be in the NICU for sugar levels.
Mm-hmm. Yeah.
Um so funny enough, so I had a C-section schedule. So I had to go in every week for an ultrasound just to monitor her growth and NST's done.
Mm-hmm.
And the NST is the non-stress test that I had to have done. So
Mm-hmm.
it was as much when I tell people that they're like, "Oh, that must be stressful," but at the same time, it was nice to have that reassurance and to know
Yeah.
that
Yeah.
I was getting checked on a lot. Um, and then yeah, I had a C-section scheduled for 37 weeks. The stubborn little sorry, for 36 weeks I had it scheduled
Okay.
because I was either 36 or 37. I got to pick my date and I was very excited to pick May 5th because 5/5, that's so easy. And my birthday is 7/7. So I was like, we can have a matching. And my stubborn little lady, I went into labor with her the day before.
Oh, wow. So
So
you did end up going to spontaneous labor, yeah.
I did. So it was the day before. It was like 1 in the morning, and I woke up and my stomach really hurt, and I was like, "No, I'm just nervous. I'm having a baby tomorrow. Like I got a lot to do." And then I went into the bathroom, and my husband works construction, so he is usually up and out of the house super early, and
Yeah.
um, at this point it was I don't know like 3 or 4 in the morning, and I said, hey, like shouldn't you be going to work? And he goes, no, no, I'm gonna have the last day, like we could just spend it together. I was like, okay, great.
Yeah.
And I had gone into the bathroom and I turned on the light and the toilet was full of blood.
Oh,
So I panicked and I was like, okay, my stomach
yeah.
hurts, which I didn't realize at the time that they were contractions. And I panicked because my mom actually, for me, anything with blood scared me. My mom's placenta
Mm-hmm.
detached when she was pregnant with my
Uh,
brother, and my brother
okay.
has CP as a result of it. So I panicked and I said, we
Of
gotta go.
course.
So we flew to the hospital, and I was later told that that was my mucus plug. Close it? You can close it. I was later told that that was my mucus plug, but I thought mucus plug is brown. I never realized that it could be blood. So that was something that I
Mm-hmm.
also learned that time. So yeah, and then so that was the May 4th that morning, and I went in. We got to the hospital around 5:30, just before 6 a.m., and she was out by 8:30 in the morning.
Yeah. It's very fast.
Yeah, she had a little fast delivery into the world. So
Wow. Yeah,
yeah,
C-sections it's always so fast.
it's
Just
so fast, and
what takes a while is the stitching, but not for the baby to come out.
exactly. I know they were quick, and the thing that I didn't like was they gave me that like neutralizer, and that made me really shaky because I didn't prep
Uh,
for it properly.
for me, like just getting the epidural, I was literally convulsing on the table, like
Oh, see,
shaking so much.
that was with my second. So with
Uh,
the epidural part did not scare me at all. Well,
mm-hmm.
I'm not gonna say didn't scare me. I think I was in just such shock that I didn't. I'm a chatty Cathy. I didn't say a single word to anybody in that OR. I walked in, dead silence. The nurses were amazing. They're like, good morning, because it was just a shift
Yeah.
rotation. So all the nurses were excited to deliver their first baby of the day. So yeah, the C-section part, I was so scared for, but I don't think that it was just such a shock that she came so quick. And I remember asking the doctors when they were like, yeah, like you're in active labor. She's ready to come out. I was like, okay, but I'm scheduled to come in tomorrow. Can I go home now and come back tomorrow? And they're like, no, like you're ready to go now.
Yeah.
So they shoved me right in and they were like, yeah, like and I had figured, I'm like, okay, they're probably busy. Like me, I can go home, get my stuff and come back. And they were like, no, you're
Mm-hmm.
next.
Oh, wow.
So I think it was just, I kind of preferred that though, that it was just quick. Um, yeah. And you're so right. about the part where it's so quick to take them out. I think my daughter was out within like 7 or 9 minutes.
So
Amazed by that
fast.
part where it's like I just laid down and they just asked me if I could feel anything, and then I heard cries. I was like, oh my gosh, that
Yeah.
was fast. But then when they
Yeah.
were stitching me back up, I was looking at the clock. I'm like, oh my gosh, why is this part taking? Is
Yeah.
everything
Yeah.
okay? Because it's taking
Exactly.
so long.
Yeah.
Um, but yeah, it was quick. I think it was like
Amazing
30
though.
something, like just under 40
Yeah.
minutes in
Yeah.
total.
Yeah.
So
Yeah.
it was
That's standard.
easy.
Yeah.
Yes, my
So
OB
when
was,
she came out, did she come out crying?
yes, she was
Yeah.
instant. She was teeny tiny. She was less than 2 kilos. So she was 4.3 pounds,
Oh,
or
yeah.
4 pounds, 3 ounces, I should say.
Mhm.
I think it was like 1,800 grams. She was
Mhm.
crying. She was amazing. Her eyes were wide
Oh.
open. Yeah, she was really
Oh.
good. She didn't latch because she was just a little weakling. So even in like the when she was inside, she like never sucked on to like the umbilical cord or her
Mm.
fingers.
Mhm.
Um, but other than, and then they took me to the maternal ward with her. And
Oh,
they
okay.
and
So she
then
didn't have to go to the NICU right away.
she did. So they were so
Okay.
busy, so they kind of let me have her for a little bit because she looked fine.
Yeah. Okay,
And then
good.
they took her sugars and they were just a little bit below what they wanted them to be. So they took her. Can you say hi?
Hi. That looks yummy.
Her sugars were a little bit lower. I can't remember the numbers, but they weren't alarming. They were just like, we're gonna take her in.
Yeah, yeah.
Um, and then so I got pushed into the high risk ward where moms were on bed rest.
Mm.
So this is where my journey kind of was night and day with my first and my second. So on the maternal ward, I guess because they were so busy, so if you didn't have your baby with you, you kind of got pushed out into the other ward.
Yeah.
So I got put into the high risk ward, and I didn't realize until with my second of how different the care was there because the nurses just weren't
Mm.
used to it. So I had her at 8:30 in the morning. And like I would get checked in on, kind of. The doctors came around and the nurses came around. They like pushed on me, like that classic, like
Yeah. The funda
Mhm.
massage.
Yes. However, until 12 hours later, when it was time for me to get up to go pee for the first time, the nurse checked my catheter, I guess, for the first time, and she
Oh.
realized it was knotted or like twisted and not emptying.
Oh, my
Yes. So
goodness.
I was in so much pain, and I just thought that that was regular
Uh,
C-section pain, but I was just
yeah.
so full of
Oh
fluids.
my God.
Yes, where I literally like there's my husband took a picture of me eating dinner, like I was so hungry, like lying down because I
Yeah.
couldn't even like move my shoulders. And then so they asked me to get up, and it was so hard. I almost passed out. The amount of
Ugh.
like blood that came out was just horrifying.
Yeah.
And then we somehow made it to the toilet, but I was so awful. Like I was just so hot and
Ugh.
sweaty that the nurse called for someone to come help because there's,
Totally.
yes.
Yeah.
And she was like,
Were
okay, we
you
need,
able to actually pee immediately after they removed the Foley?
no.
Yeah.
It took me 2 hours later. So they
Did they
came
have
back.
to drain?
Yes.
Yeah.
Yes. So did they, she didn't, yes, because she removed it because I went pee. I don't remember, but I know I didn't go pee then because I was just in so
Yeah.
much pain from just like
Yeah.
getting up for the first time.
Totally. Yeah.
Yes. And then I think I stayed in bed for another, I want to say an hour and a half or 2 hours because I think she came an hour later and I was like, I'm not ready. And
Mm-hmm.
then I went the second time. So I think it was just under 2 hours later. And I filled the bucket up like overflowing
Totally.
because I had
Yeah,
so
of
much
course.
inside. But then I did feel better after that. Like the pain kind of started to
Good.
subside a little
Good.
bit.
Yeah. So
Um,
having your bladder full can also make you be bleeding more. So like
oh, I didn't know
frequently
that.
emptying your bladder postpartum is very important. But
Okay.
also the policy is different for every hospital. So like the hospital I was working at prior to mat leave, it was like between 6 and 8 hours. Policies
Okay.
are always changing. But
Okay.
for when you would stand up the patient post C-section and remove the Foley.
Right.
So for those listening, if you ever get a Foley for whatever reason, make sure that the bag is hanging, it's below you, because sometimes nurses will forget the bag on the bed as well, and then it's like leveled, and that can also make it hard to drain.
Right to empty. Yeah.
So make sure that it's like hanging on the bed and that it's not kinked. And like if you had a C-section, if after like 6 8 hours no one has come like call someone.
call someone to check.
Have someone take a look. You can even check, make sure it's draining
Well, that
because we
was
don't
with my
think about it,
second.
right? You don't
No,
feel it.
I had no
Exactly.
idea, and
You wouldn't even
especially
think of it.
no,
Yeah,
I've never had surgery or anything done before,
totally.
and then it was through like COVID times. Like I was only
Yeah.
allowed my husband with me, and even my mom was saying she felt so bad about that. She was like, "I wish I had known."
Of
Like I wish
course.
I, and
Yeah.
my mom had
Oh,
two as well, so she goes, "I wish I had known because I would have checked that for you." I'm like,
of
"Mom, like,
course.
how
That's
are
not
you
her
supposed to
job.
know, right?" I know. It's like,
Of
how are you
course, but that's
supposed
so
to know?
sweet.
I
Yeah.
know. So, but you just feel that like guilt, right? Where it's like,
Yeah, of
how are you
course.
supposed to know? So,
Totally.
but
Yes, yeah.
but yeah, other than that, after I felt fine, so oh, I also forgot to add I had preeclampsia.
With the
So
first pregnancy, yeah.
yes, with my second as well. So with my first, I was not on any medication during pregnancy. I kind of it wasn't as high. It was still okay where they're like you don't need it yet, and then it
They
was
were just
after.
monitoring.
Yes. And then after I delivered and they were taking me in the hospital, it shot even higher. So they
Uh,
put me on labetalol and I was on it. They kept me in the hospital actually for an extra night. So I was in the
yeah,
hospital for
yeah.
3 nights. Um, and it was very high, but they monitored me for it. I was on labetalol for about 6 weeks, which made me feel horrible because I didn't
Did it?
realize
Yeah.
how, yes, I didn't realize how much you crashed from it. And I wasn't
Mm.
aware of the effects. And I was like, I'm tired. I just had a baby.
Mm-hmm.
And I realized that with my second after, like when I was taking it, how much I would crash from it. I was like, oh, this is why I felt so
Uh,
horrible postpartum with my first. Um, so yeah, so I was in the hospital for an extra night with that. So 3 nights in total. While I was in the hospital, I had no milk come in at all. The
hmm.
second I got home, I pumped out so much, which was so
Yeah.
lovely because it was just the nurses told me that too. They're like, you'll be in the comfort of your own home and
Yeah.
it's different. And
Yeah.
they were so right. Like I had my dog beside me because my daughter was still in the
Totally.
NICU. So,
Oh,
so
yeah.
she was in the NICU for 9 days. It
Oh,
was just a
okay.
matter of her getting her sugars up and being able to
Yeah.
eat the proper amount within that time span.
So were you able to pump and then bring milk for
Yes,
her?
yes,
Yeah, okay,
because she never
lovely.
latched on. We worked
Yeah,
on it,
she's
but
very tiny.
yes, she was so tiny. She had no energy. She was a weak
Yeah.
eater. She still is almost 4 years later. And I remember the nurses had offered, they're like, if you want to breastfeed her, then you have to stay overnight. We have to weigh her. And it stressed me out. I had one of the nurses tell me, they're like, you know what? Just go home, work on it at home. Just get a lactation consultant to come to your house. They're like, you don't need to be here with her, right? Like she's an easy. They called her the feeder and grower baby. She's like, you'll just be. She's like, look at what happened to you when you went home and how all of your milk came in the comfort of your own home. And I was like, you know what? You're right. So she was fine to go home. So she went home on day 9. And I had frequent doctor check-ins with my family doctor just to see her weight
Hmm.
go up. And it was okay. She was quite slow on the curve, but she was following it.
Yeah.
As soon as I found I was pregnant, I could never like envision myself giving labor. It was just, I think I was so scared of it.
Yeah.
I was okay with having a C-section. It was more so like the breastfeeding part that did not work for us at all. And I think because she was so tiny, I enjoyed seeing how much she was drinking from a bottle because
Yeah.
I knew
Yeah.
because she had to eat X amount within like 30 minutes. So I
Yeah.
did enjoy that part. Pumping was hard. I had a
Yeah.
lot, which was nice, but I still supplemented with formula because I had a lot of milk, but it was very watery.
Hmm.
So I didn't have a lot of I forget which one it is. There's the fore and the hind milk. It was a lot of
Yeah. So
just like the
the
watery
fore
part.
milk, yeah.
Yes. So I didn't have much of like the fat content. So I
Mm-hmm.
supplemented with formula as well. She was fine. She was a really good baby. I would never say I had any like major problems with her other
Mm-hmm.
than like her just eating. You have to like pinch her feet, like get her
Yeah,
like mad
yeah.
to eat.
Yeah.
Um, but other than that, like postpartum hit me like a ton of bricks.
Yeah.
I've never, I'm lucky enough to say I've never been like a depressed or like anxious person. And I
Mm-hmm.
think like um, the thoughts and everything, like the intrusive thoughts just like knocked me off my feet.
Yeah.
I would be carrying her down the stairs and I would go, don't drop her because her head's going to crack open like a
Yes.
watermelon.
Yes.
And it scared the
Isn't it wild?
And
Yeah.
I was not expecting
Wild.
that.
Me neither.
And I actually read the other day where it's like your natural instincts just giving you the worst possible scenario so you can
Yeah.
protect that baby with all you have. And I was like,
Yeah.
oh, like, like it's amazing, but it's horrifying, right? And
Right?
it's
Yes.
the scariest thing. And
It is
I,
actually crazy. Yeah.
yeah. So when any of my girlfriends now have babies, I always make sure to be like, how are you doing? Like, how are you doing?
Mm-hmm.
And I think that that was hard for me because my doctor never checked in on that. I remember I went for
Yeah.
I think it was a 2 or 3 week because I had to take her every week to the doctor to check monitor her weight. And I asked my doctor, I'm like, can you just check my incision to make sure it's okay?
Mm-hmm.
Because she never focused on me.
Oh.
And she was like, sure, no problem. Because I had a few girlfriends who we all had kids at the same time, like I said. And we
Mm-hmm.
were like, yeah, my doctor's great. And she did this and she did that. And I was like, why is my not doctor not asking anything?
Yeah.
And so she checked it. She's like, yeah, it's lovely. Like, that's a great cut. And then I sat up and she goes, do you want to go on birth control so you don't get pregnant again? And I go, how about maybe you ask me like how I'm feeling
Yeah.
as a first time
Yeah.
mom, right?
Yeah.
So I switched family doctors after that because I was
Good.
like, I was like, that's not really a question. I was like, I'm like, that's not even
Yeah.
a thought in my mind right now.
Yeah. Yeah.
So, and like nothing, like no, I'm so lucky that I had amazing friends and neighbors
Good.
who
Good.
like
Yeah.
kept an eye out. And I remember it was around like 2 months, 2.5 months. We were at our family cottage and I just didn't want anyone to touch her. I was like, don't touch my baby. And when I was telling my neighbors that, and my neighbor said, you know what, you can put her in a carrier. And if you really need, she's like, if you're really struggling, like there's like this like resource group and like this like circle of women that like talk about it. She's like, I went to one of
Mm-hmm.
them and I was like, I wish my family doctor had told me about that, right? Like that's such
Right?
an
Yeah.
important thing to know.
Totally.
Like
Yeah.
all
It's
these
so
resources and
important.
stuff. Yeah, which like I
Some
feel
hospitals, they do give you a like booklet with a bunch of resources
I
postpartum.
feel as if I got that too, but I think it was just so much
It
information
is.
thrown
It
my
is.
way
A
that
hundred percent.
yeah, and like you're so overwhelmed, and like especially having a NICU baby, I was like, oh, like
Oh,
this and this, and like
totally.
the pumping, like when the lactation nurse
Overload.
came in, it was just like ba 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 ba, and you
Yeah.
just like can't process all
You're
of this
just kind of like, wait,
information.
I had a baby? Like,
Yeah, and it's
like
just
nothing
all this
sticks.
exactly
Totally.
nothing
Yeah,
sticks, and
that's
it's
not
like
enough. And I always felt bad going into rooms before discharge and going through the whole spiel because I like they're just staring at me
what are you saying right now?
like
Yeah,
just like they're still like, wait, I had a baby? Like what?
yeah,
Like
yeah.
so totally. It
It's
doesn't
so
stick.
much.
And there
Yes.
should be more follow-up,
Follow up
especially for
after,
first-time
right? I know
moms.
when you
Yeah.
get to yourself, and I remember one of my neighbors told
Mm-hmm.
me, she goes, the first 6 weeks are survival mode. And I was like, what is that supposed to mean? She told me that before I had her. And I remember I hit 6 weeks and I was like, whew, like I feel better. It took
Yeah,
me up
yeah.
until then. And same thing with the C-section. It took, I remember I had her on a Tuesday and it was Tuesday, 4 weeks, literally to the day that I finally felt okay.
Yeah.
I think my problem too was that I had a May baby and it was nice outside and I wanted to get outside. I pushed myself
Mm.
way too hard. I didn't recover properly. Like my C-section scar hurt. So actually 3 months postpartum, I went on like this major power walk with her and I started to feel like a little pinch and I was like, ooh,
Uh,
ouch. And then I got home and it started hurting more and more to the point where like I was like this, like bent over and I couldn't even
uh-huh.
get up.
Oh.
So I went to, I didn't go to the ER. There's an awesome urgent care clinic by us. So I went there and they were like, you know what? Like we know what's going on. Like you had a C-section. She's like, a lot of times moms will like tear or something like when it's healing back together, it'll just
Yeah.
come undone when you push it.
Mm-hmm.
So I always like with my second, I made sure to like really take it easy. And like,
Yeah.
yes, it's harder when you have a toddler, but
Mm-hmm.
I had him in the winter for a reason because I was like, I don't want to go outside. I know you can't
Yeah.
plan that, but I was like, I want a winter baby, and I was lucky enough to
Yeah,
have a
that's
winter
funny.
baby.
Yeah.
So I made sure
That's
just to
such a
like,
positive way of looking
yeah,
at it. Because a lot
exactly.
of people are like, oh no, winter baby's the worst. You can't go outside. But
No,
see,
I
this
was
is
like, I want to stay
something.
inside because I'm
Yeah,
such
you
an
get to really relax
outdoors
inside.
person.
Yeah.
Yeah, and I love going for walks and everything. I was like, no, I want a winter baby, so I'm housebound.
Yeah.
I can't go outside. But Yeah, other than that, like postpartum, I would say like the postpartum, like the intrusive thoughts and like the anxiety, it took me a good 3 months to feel better and
Yeah.
like more confident. I always was out and about with her. I felt comfortable doing that. It was just like those thoughts, like you would be driving
Mm-hmm.
over a bridge and you would be like, "Okay, I gotta roll my windows down because this bridge is gonna fall apart in a second. My car's
Mm-hmm.
gonna blow over, right?" And
Totally.
that
Yeah.
part really like threw me off. Um,
Yeah. I'm
but
glad
other than
you're
that,
bringing this up because it is something that's
yes.
so real and just
Yes.
not talked about enough.
It's
So,
not. It's
yeah.
not. So yeah, it is, and it's really scary. And then you see all these like things happen, like the postpartum psychosis, and you hear all those
Totally.
horrible stories. And I'll scroll through the comments, and these people are like, "How could that mother do that?" I'm like,
Mm-hmm.
you have no idea what that mom's
Yeah.
going through, and
Mm-hmm.
it's not her. It's all your hormones and
Exactly.
everything, and it's exactly. It's not talked about. It's not brought attention. It's really unfortunate.
Yeah. Yeah, totally. Yeah.
But yeah, but we made it. We're good. I got
Good.
pregnant when she was 13 months. I was ready for one more.
Nice.
So yeah, I got pregnant when my daughter was 13 months. I was also, I'll mention I was lucky enough, like with both, it was first try. I got really lucky. I got
Nice.
pregnant both first try.
Did you go
Um,
back on birth control
no, I never did.
between? No. Okay.
Even
So
like
just
now I'm like, nope, I'm okay. It's
same.
you
So
know what?
just fertility awareness method,
Yeah,
condoms.
yeah.
Yeah.
It took me when I was on birth control in university. When I came off of it, I remember when I was working at the time, the girls were like, "Oh, it's gonna take you so long to go back to normal." I was like, "What does that mean?" And
Yeah.
it did. Like my face was puffy and like the breakouts. I was just like, I don't want to deal with that again.
Totally,
It's
totally.
not
I
worth it,
agree.
right?
It's not worth it.
It's not worth
It's
it.
not good for us. So,
Exactly. You always hear
yeah,
stories about birth control, so I'm just like, no,
totally.
I'm
And it
okay.
just makes us actually start to learn about our cycles and work with it
Well,
instead of just suppressing it,
exactly.
right?
100%. I totally agree with that.
Mm-hmm.
So yeah, so I got pregnant with my son. I was automatically put into the high risk because my daughter was so
Because of the
high risk.
previous pregnancy.
Yes. So I couldn't have a
Mm-hmm.
midwife, which was okay because I think I'm like that one person in a whole bunch that liked my OB better than my midwife. I feel as
Yeah.
if I was like in much more in but I think also because I was constantly like with my NSTs and my ultrasounds, I had so much more
Yeah.
check-ins.
Yeah.
So when my girlfriends would be like, "Oh, like I haven't had an ultrasound in like 2 months," I'm like, "What do you mean? Like I had one 2 weeks ago. I'm ready for my next one like tomorrow." Um, so I was automatically put into high risk. I had a different OB, but I didn't really mind. But yeah, so he was doing fine. My blood pressure was high, but then it was something that we were like learning about. So after my daughter, I went on the high blood pressure pills and I stopped them at 6 weeks postpartum
Right.
because my blood pressure went back down to normal. It was still elevated a little bit more. So it was kind of something learned. I never checked my blood pressure before kids. So I
Mm-hmm.
just think that I have high blood pressure as a person. My
Your
dad
like
does.
baseline. Yeah.
Yes, it's higher. Even after I had my son, like a year and a half later, we were all taking our blood pressure and it was high. So I think that
Yeah.
was just
Okay.
me. Um,
Mm-hmm.
so I was high risk, but he was doing great. Like I was showing more, I wouldn't necessarily say I was bigger, but then I also kind of learned I was like, maybe I'm just like a carry different. But he was on track. Like he was 44th percentile. Like my tummy was measuring fine. Like I was never 3 weeks
Mm-hmm.
behind. I don't remember at what appointment so I think I had ultrasounds every 2 weeks with him just to make sure everything was okay. And at one, he was 44th percentile. I remember I drove home with tears of joy because I was like, oh my gosh, like my daughter was zero.
Yeah.
Like she went from being, I never heard her like go over eighth. So I was like, when they said 44, I was like, this is so exciting. Like he's big.
Yeah.
I get to have a big size baby. And then I went to my next one and it was so random. It was like a Friday night that it was like a 7 p.m. appointment. And then the ultrasound tech goes, she finished and she goes, okay, I just want you to hang out here because I need to send the OB stuff. And when she said that, I was like, oh no, like
Uh-oh, yeah.
what's going on? And she took a long time with the ultrasound,
Mm,
like especially having them so often, like they were quick, right? And
yeah.
I was like, oh no, like what's happening this time, right? And so they the OB came in and she kind of just said, she's like, yeah, like, he stopped growing, like he's still growing, but he really fell down with his growth. Like he's at,
Mm.
I think he went down to like 11th or 12th percentile. I don't remember the number, but he went from
Mm.
being like in the middle to down to like baseline. I remember with my daughter, they're like anything below 10th is alarming. So I was like, oh
And
no,
what week was this?
I don't remember. I'd
Okay.
have to, I want to say though, it was just around like third. So I would say close to like similar times as it was with my daughter. So I think it was like 28 or 29, maybe 30. I don't remember. But they were like, yeah, he's like his growth has slowed down. Um, Also an important thing to add on was I was cleared for a VBAC from the beginning. They were like, yep, you're a great candidate for
Okay.
VBAC because they would be 20 months apart. So I guess
Mm.
is kind of the clear. They're like, yep,
Yeah.
you can go ahead. Do you want to try for it? I was like, yep, I totally do. Um, so I had to go back to my OB and they put me on like extra monitoring now. I was not placed on bed rest or anything. They were just like, the drill,
Yeah,
kind
yeah.
of. But I didn't have the umbilical, like my umbilical cord was fine. So it wasn't that. It was just they never really like gave me a reason as to why he stopped growing. They just
Mm-hmm.
said it's because of my preeclampsia. With my son, my blood pressure was significantly higher than it was with my daughter.
Oh, okay.
Like it would go up to I think like I think my highest was like 180 over like 102. Like it was
Oh, wow.
very high.
Yeah, yeah.
So I never admitted, but I was hospitalized like I went to the hospital a few
Oh,
times
okay.
because I was checking day and night. And they were like, if it ever goes this, like, don't even ask us
Yeah,
if you should
yeah.
come in, just come
Yeah,
in.
yeah.
So I was taken to the hospital a few times, I think like 4 times where I would go and be
Oh,
monitored for a
wow.
few hours.
Mm-hmm.
So I was put on labetalol, like on the highest dose, which just like knocks you off
Mm.
your feet. So they would just kind of keep me there because you shouldn't like I was just so low after it that they were like, no, like just take your
Yeah.
time, like don't drive home yet. So that was a few times. And then it was kind of like they told me I had to have him by 38 weeks. So it was a little bit longer than it was with my daughter. She was
Mm-hmm.
37. So they're like, he
Yeah.
has to come out at 38. Um, and then it was at 36 weeks. I was actually going through text messages to find dates. It was at 36 weeks where they told me, nope, you're not having a VBAC anymore. You need a C-section. And that was all that
And
they said. And I think I was kind of
didn't give you a reason?
no. So I think I was
Hmm.
kind of just like upset at that time where I didn't even ask questions.
Right.
They're like, you need a C-section. I was like, okay, whatever. And I had told myself because my OB was going to be gone, I'm like, well, she's gone, so they want to schedule me in, like, make it easy.
Yeah.
And then I had actually later on learned why. So, I'm a family photographer and I was taking photos for an ER doctor and they had just had a baby. And I said, I was like, hey, like, can you tell me why I had to have a C-section and not a VBAC? And he goes, yeah, like, what was your issue? And I go, well, I had preeclampsia and then like this. And then after I had my son, they told me that my placenta was almost dead. So he said, he's like, that's why. He's like, because your placenta like wouldn't have let him survive, like not survive. It would have made him very difficult for him to like to go through labor.
Through
Like
an
he wouldn't have been
induction.
able to handle it. Yes, because they said
Mm.
I would have to be unless I went into labor earlier and there
Yeah,
was
it
a
would
good
have been an
chance that I
induction.
did. It would have been, I would have to be induced at 38 weeks. They're like he
Yeah.
wouldn't have been able to handle it because your placenta wouldn't support him through it.
Mm-hmm.
I was like, that took you 2 seconds to explain it to me. Like I wish they did then.
Right? Yeah.
But I
Yeah.
mean, when you get like that news, it's that same thing with like the postpartum, right? It's like you just
Yeah.
don't ask questions. Like,
Yeah.
okay, and they're like, pick a date, and I picked my date. It was Valentine's Day. They're like, do you want the 13th
Oh.
or the 14th? I'm like, 14th. So
Oh.
it was kind of like I was so prepared to have a VBAC, and I was so excited that I was upset,
Yeah.
like I was.
Totally.
But then I told myself, I'm like, you know what? Like, you hear all these stories, and I'm like, I don't know how my body would have acted. Like, who knows, right? I'm like,
Mm-hmm.
in my mind, I was like, oh, like I'm gonna push this baby out. He's little, like quick, right? But then you never actually know. Like, I have girlfriends who have gone through like 30-hour labors, and I'm like, you know what? It's what it is. It sucks, but like
Yeah.
I've gone through it. I know it was an 11 a.m. C-section, and I was able to, sorry, I had to be at the hospital by 11, but we were able to drop my daughter off at daycare. My mom picked her up.
Nice.
It was nice to like schedule it
The
in that way.
planning, yeah, is
Yeah, versus like being like
something
my neighbors
different,
like
yeah.
before that were on call. They're like, if you go into labor at nighttime, like let us know. Like we'll take Ava, and like
Yeah.
by the time your mom comes here. So it was amazing to have that village.
Yeah, yeah.
But it was also kind of nice in that one aspect to go at a scheduled time.
Mm-hmm.
Um, but I hated my second C-section.
Yeah.
With my first, I think I was more scared, but I didn't like not love it. I think it was just like, okay, it was my first experience. I didn't have any
Right.
feelings towards it. But with my son, I was just so horrified of it because I knew what to expect. And I was like in my mind, like running through the process. And I knew exactly like, okay, like he's gonna come out quick, right? And I'm gonna get stitched up in 32
Mm-hmm.
minutes. Like I had all these numbers in
Yeah.
my head. And so I went in and I was just like shaking going in because it's so
Oh.
scary, right? Like the
Yeah.
OR, and it's
The
not a
OR
great
is
place
not a
to
nice
be.
environment. It just feels
No.
cold and
And
sterile,
they,
yeah.
exactly. And like the nurses, like I can't speak to them. Like they were lovely and like playing music and like having fun and so welcoming and asking me all these questions. And I was just dead silent. And yeah, the spinal tap was not bad at all. I would say both times I did not feel it. It's scary, but it wasn't like I never felt like a sensation or anything. The part where you can't feel your toes when they tell you to wiggle them is like an out of
So
body
weird.
experience. It's yes, so, so weird.
Yeah.
But with my second, it took them a lot longer to get started on me. So even
Mm.
my husband noticed that, like once he came in, he goes, "That took longer." I'm like, "I know," and I guess they it just took them a little bit longer to freeze me because they had to like, "Can you feel that?" And I was like, "Yes, I can." So they're like,
Okay.
"Okay, hold on." So they had to up it, to which it kind of made it harder for me to breathe.
Oh,
So at
yeah.
one point, like I felt like there was an elephant sitting on my chest, and
Oh,
I think
that's
like
the
you panic
worst.
even
Yeah,
more.
totally.
So,
Absolutely.
and he was not a COVID baby, but he was right before like the masks had ended in hospital. So they're like, "Hey, like take your mask
Oh,
off." Like I was like, "I can't breathe."
yeah.
Um, so that was okay. Like they were monitoring me. They're like, "You're
Mm-hmm.
okay," and I was like, "Okay." Like I don't feel okay, but
Mm-hmm.
he came out. I think it took him a little bit longer, but they took him out fine. He was a very low baby, so I had
Mm.
bruising all over me after because even like on my ultrasounds, I was like, "Nope,
Yeah.
gotta go lower." Like he's down there. Um, so that was the other interesting part. Like I had bruised, whereas like my daughter was clean cut, everything was great. Versus him, like I was all bruised over, and I like felt it a lot more. I think like there was a lot more
Mm.
pressure when they took him out.
Yeah.
But he came out. He came out crying like instantly. He peed right away. He peed all over the
Oh,
the
yeah.
OR floor. So he
Beautiful
was, yeah, but he
boy.
was, I thought he'd be bigger. He was 5 pounds, 9 ounces. So still
Okay.
almost 2 pounds bigger than my daughter, but still teeny tiny. Um, but he did not have to go into the NICU, which was lovely.
Right. Good,
Um,
good.
the hospital was empty when I had him because even when they asked me what date I wanted to schedule him in for, I was like, "Oh, Valentine's Day, I love that." There was nobody on the floor compared to with my daughter. I got kicked out of the floor
Yeah.
when I would go for a walk, and that was the other thing. I like barely went for a walk with my daughter. With him, I was like up that night walking.
Mm.
Um, there was no one there. So I feel as if this also plays a role into my postpartum care with the nurses. I felt like a
Mm-hmm.
queen. They took him. They're like, "You sleep, mama," because everybody knew we had a 2 under 2 at home now, and
Yeah.
they took him. They're like, "We'll snuggle him." Like
No.
they gave him a bath. They like made sure he was okay. They fed him because so he also did it. He was a whole other story with feeding issues. So
Yeah.
I was so ready to breastfeed this time. He didn't latch, and right away they're like, "He's got a tongue tie, and it's a bad one." Um,
Mm.
so they were like, "Just give him bottles for now," because I don't think they cut them in the hospital anymore. I think it depends
Yeah.
on the
I think it
hospital.
depends. Yeah.
So they were
Yeah.
like, not that they were like, it's not even like a point of you trying, but they're like, "He's not gonna latch. Like you need to get that looked at." So they gave me a lot of referrals for a dentist to do it. So we gave him bottles, which was fine because that's what I was used to.
Mm-hmm.
He was hungry. Like
Yeah.
he was malnourished in me.
No.
The doctors would be like, or sorry, the nurse was like, how much did he have? And I was like, oh, he had like 3 or 4 meals. They're like, well, he should only have one. I'm like, he's hungry. Like I've had a
Oh
baby
my
before that
goodness.
didn't eat. Like he could not stop.
Yeah.
And he
Yeah.
was crying all the time. And then they're like, oh, he's just upset. I'm like, no, he's hungry. And he would just keep eating. And he doesn't stop to this day. So he was great. He was just a little mucusy, which I did pull the tab at one point because he was like really gagging. And I was like, oh no, what's
Yeah.
wrong?
So that's
Um,
something I'll just mention really quickly. When you have a vaginal birth, the baby is usually coming head down,
yes.
and you have enough time for the baby to be compressed so that excess mucus comes out. But when it's a C-section, that doesn't happen. That process
I didn't know that.
doesn't happen. So C-section babies are usually more mucusy.
Mucusy. Okay,
Yeah.
makes sense, right? That's so interesting. So yeah, he's a more mucusy baby, but he was amazing. Like he slept really well.
Did he end up with the tongue tie? Was it a real tongue tie?
Yes, yes.
Yeah.
So he never latched on. You want to come sit over here, dude? This is the big guy.
Hi.
So he had his tongue tie. I went to the baby dentist with him. So this is a whole experience in itself. If I can like just interrupt with like postpartum, I think I was so prepared with my not my bad postpartum experience with my daughter, but just like being aware of like the thoughts and
Totally,
everything.
yeah.
I had such a better ride with him where I think I was just so prepared to like the signs to look forward to where I didn't experience that. Whereas I hear some moms are, oh, it was so much worse with my second. I'm like, I was great with him. I was just tired. Like my daughter was
Yeah.
only in daycare 2 times a week. That was my choice. I'm like, I want both my kids
Of
home.
course.
But I think I was just so busy, like having two under two, like I
Yeah.
didn't have those thoughts and I kind of knew how to like help myself if I did and I just prepared it. Whereas with my daughter, I didn't even know that was a thing and it just rocked me. So in that aspect, I was great. But for him, the hard part was his tongue tie. So he had his tongue tie. He took a bottle just fine though. And we took him to the dentist and they saw it was there. So they kind of gave me an option. They were like, listen, like he's taking a bottle fine. They showed me how to breastfeed him in different positions. And of course, in the dental office, he latched onto me like his day job. He did it just fine. Brought him home, nothing. I went back for a follow-up treatment, latched onto me just fine. And like, I could feel him like feeding from me. Brought him home, nothing. I was like, you bugger. So I was like, hey, if we're going to bottle feed, we'll bottle feed. It's fine. Like I pumped, same thing. I supplemented with formula because my milk was really watery. And I was like, you know what? Like it is what it is. It's okay. And I was used to it. It was fine. He ate so much. And I was like, I was again a little bit upset, but I don't know, like I didn't have it like in me to like push myself to do it. But we were okay with it. He ate a lot. The dentist kind of gave me a few warning signs. They were like, if you're fine with bottle feeding, that's fine. Just keep an eye on his like it's not affecting his bottle feeding. Just keep an eye on when he starts solids because it might affect that. If not, then keep an eye on his speech because it might affect his speech.
Okay.
So 5-ish months rolls around and I wanted to introduce him to just solids like a little bit. Like I just gave him some like baby purees and I put a spoon in his mouth and he just projectile vomited. Also, he was a very pukey baby with the bottle. However, I didn't know if he had like reflux or anything. I bought him, he was pretty gassy, but once I switched his probiotics, he was great.
Good.
He just puked all the time. He had to be upright. Like even in the bassinet, like napping, he had to be in a bouncer or on me because in the bassinet, like the one we had for our stroller, he couldn't. So, but it didn't affect his growth. He gained 4 pounds in his first month. Like he puked a lot, but it was never an issue because he was so on the growth chart. Like he was going above and beyond because he was gaining weight like massive and he was a big baby. But 5.5, 6 months rolls around and anytime I would introduce food to him, it was just horrific. Like puking, wouldn't take it, had no idea what to do with it. So I kind of went back, I called the dentist and I was like, okay, this is what's going on. They're like, you should get it cut. So I did, which was horrible. I
Oh.
didn't realize that there's like dentists that specialize it and then dentists that have absolutely no idea what they're doing. I
Yeah.
should have left when the team kind of said, well, how do you want us to open his mouth? And I'm like, aren't you supposed to like know how to do
Yeah,
this?
yeah, yeah.
I don't think they froze him properly because he was screaming bloody murder, and like thinking about it makes me want to cry. Like it was like the
Oh,
worst
I'm
mom
so
guilt.
sorry.
So it
No.
was horrible.
But even if they
They
had frozen him, it's probably just a
the
scary situation for
traumatic
him. Yeah.
exactly, but that night he like didn't eat anything, nothing, and like you know how
Yeah.
it's scary when babies don't eat, and
Totally.
he was just a mess. And he's
Oh.
also just a very active boy and is to this day. So I think also like being like held down just traumatized
Yeah.
him.
Yeah.
And I think the whole experience of people in his mouth traumatized him even more. So from that point on, the feeding was even worse.
Oh.
So like anytime I try and put a spoon by his mouth, would swat it away. Anytime I try and put anything but a bottle in his mouth, he was just like, nope, I'm not having it. Like this is
Yeah.
horrible. I would
Yeah.
try and give him like little pieces of food, like baby led weaning, nothing. Um, so around 8 months, I just kept trying and trying and trying. At 8 months, I took him to my family doctor. I was like, listen, he's 8 months old. He's not eating. Like,
Mm-hmm.
this isn't
Yeah.
okay. At 8 months, my daughter was eating dinner
Yeah.
with us.
Yeah.
And she goes, this is a different family doctor from the one before. She goes, but he's 8 months. That's okay. Like, he can still work on it. I was like, but not really, right? So I kind of took matters into my own hands and I posted in our, like, my local mom group. And I said,
Uh-huh.
I explained the situation and they were amazing. I didn't even realize you could go to I went to a few moms had said that their kids who were tongue tied had difficulty as well.
Mm-hmm.
And a few moms had recommended to take him to a speech language pathologist that
Mm-hmm.
worked with feeding issues, which I had no
Yeah.
idea was a thing. And I always thought I'm also a teacher, and I always thought speech language pathologists have like the coolest job ever. I think it's amazing.
Yeah. It is really cool.
So I
Yeah.
had no idea that they work with feeding issues. And there was one that was recommended to me. So I booked an appointment with her. And I think I was in her office for like 2 hours. And she worked with us. She saw him puke because we tried to give him food. She was like in his mouth and everything. She was amazing. She gave me like all of these tips and tricks of like how to make him more comfortable with food. So just
Mm-hmm.
like that slow process, she's like, just like tickle him and get into his mouth, like go really slow. She like, gave me tools on like things like he wouldn't even put teethers in his mouth. Like that's how like
Oh,
traumatized
yeah,
he was by
yeah.
that.
Oh,
So he never like even binkies. He stopped like the pacifier. Like both of my kids dropped them at like 4 or 5 months.
oh yeah.
They just didn't care for them. But even like
Mm-hmm.
eating toys, he never brought them to his mouth. Like was
Yeah.
never exposed to like putting anything
Mm-hmm.
to his mouth other than a bottle.
Yeah.
So she was really great
And
with
babies are
providing
usually trying to put everything into their
exactly. And
mouths.
he
Yeah.
wasn't. He wasn't at
Yeah.
all. So this was when he was like 8.5, 9 months. And she was just giving me like tips and tricks, and it was a very, very slow process.
Mm-hmm.
He eventually she's like make stuff thicker for him and then eventually like thin it out, and she's like do it once a day and then do it like the next day. She's like don't overwhelm him with it.
Yeah.
So she really helped me a lot. And we would kind of have like
Amazing.
check-ins here and there. And then he was doing good with it. um it took him it took him quite a few months, and then I think he started eating better around like 11-ish months. But he still wasn't eating like full dinners.
Mm-hmm.
And
Okay.
then it was for his birthday. I really wanted to do a cake smash for him because
Mm-hmm.
I'm a
Yeah.
photographer as well. And I was like, I really want, like,
Yeah.
I photograph other kids doing a cake smash and my kid isn't going to
Yeah.
get one. It makes me so sad. And
Totally.
I remember I did it, and we did it. A family friend, her daughter was born the week after him. So we did it together at her house. And
Oh.
I think having her there like motivated him, and he
Mm.
was like he was smashing the cake, like he was
Yeah.
disruptive, like he likes doing stuff like that, but then he started
Yeah.
bringing it to his mouth and it kind of helped.
Oh.
And I laughed because actually the day, so I did that like 2 weeks before his birthday, and then I laughed because the day before his birthday we went on a family vacation. We went down to Florida to see my husband's grandparents, and we were there for dinner, and he was still on like purees and like really
Mm.
squished like peanut butter sandwiches, like
Mm-hmm.
into little tiny pieces, like not
Yeah.
even onto puffs yet. Like he didn't even, like I was like that's too hard for
Mm.
him. And my grandfather-in-law gave him a rib bone, and he took it, put it in his mouth, gagged on it, and that changed everything. He ate
Yeah.
everything after that. So we're like,
Wow.
all it took was granddad to help him eat.
Totally, right?
So he was a champ after that, and he
Oh,
started
lovely.
eating everything, and now he does not stop. He is an
Oh,
amazing
that's
eater.
so good.
So yeah, so he was really good with that. If I can
Yeah.
like backtrack to postpartum to my blood pressure, I never had issues. I had like minor, but not as much with her. So it's funny because I had less blood pressure with her during pregnancy and then higher after, and then with him it was
Mm-hmm.
really high during and then lower after.
Yeah.
Um, but other than that,
Did you
like with
also have like protein in your urine? Like any other
no, not an
signs? Just
alarming sight. No,
no.
no,
So it's
no.
just like no other symptoms of preeclampsia
No,
except
because I
the
know
actual blood
with my
pressure.
daughter, I found like when they were like, oh, the light in your eyes, I keep in mind like the stars. I had that a few times, but it was, and that's when I would go to the hospital to get checked
Okay.
out. But it wasn't bad. Like they were like, okay, you're okay, because they would give me blood work and everything.
Yeah.
With Luke, it was no, it was just the high blood pressure and the headaches. But
Yeah.
I
And
have
headaches.
headaches,
Yeah.
but I also have a lot of headaches. And then I'm like, okay, like maybe I had a high blood pressure before I was
Yeah.
ever
Yeah.
pregnant, and that's why I
Yeah.
have headaches, right? So I have been
Yeah.
working on those now too. But yeah, like everything's been like really good after. Like I postpartum with my second was very different than with my first, like feeling
Yeah. Yeah.
too. But yeah, I think that's
That's
like
awesome.
bless you. That's
I
like
want to touch on a few things that you brought up that I think
yeah,
are so essential to talk about.
bless you.
So, like the tongue tie,
Hmm.
like there's so much
Oh
about
yeah,
that,
I
and
forgot
I've
to
heard,
say.
yeah.
I forgot about the tongue tie. I got it recut. Actually, I forgot
So
to bring it.
after, like, what?
We
When
got
did you
it
do that?
after I saw the speech language pathologist. She took a
Oh,
look at
okay.
it and she goes, "That's not done properly. Go get
Wow.
it done again." So they did it. She was like, "Go take him to the dentist that you went and like see if they can redo it," which I struggled with doing. And they did. They cut it better next time. Um, they recut it, and I think that kind of helped it too. But I didn't see like instant
Okay.
of it. Um, but now anyone that does have a baby with a tongue tie, like please go. The SLP gave or the speech language pathologist gave me like recommendations on who to go to.
Yeah.
Um, but now I know I'm like, I would just go to someone who like actually does it, right? Like
Yeah, because I
properly.
hear it, like, I've heard a lot both ways where it's like they never knew baby had a tongue tie and, feeding was just so painful, so awful until they did it. And then it was amazing. But then I've also heard stories about where it actually made things so much worse and it was so
Worse.
traumatic. And it's like, ugh,
I
for
know.
parents, it's so, so tricky.
I know.
But the one thing that I was going to say is like, the nurses diagnosing that. Like that shouldn't even be something that the nurses diagnose. It should be a
Interesting.
lactation specialist or a doctor.
Maybe
Like,
maybe it was. I don't even. No, I think it was the nurse because right
yeah,
away he didn't latch on, and they looked in there. I guess they touched it, and they were like, "Yeah, he's got a tongue tie."
yeah,
'Cause
and
it was
like
like fairly
sometimes you can
instant.
tell right away, but it's still like nurses should not be diagnosing. But
Okay.
also to just say that he has a tongue tie. Don't even bother breastfeeding. Here's the bottle.
Yeah.
That's much
Yeah.
easier for a nurse
Yes.
than to just actually stay there with you and really help with the breastfeeding.
Yeah.
Because had you had a nurse say, you know what, looks like he has a tongue tie, go get it checked out. It might be a little bit trickier, but here, let's try a few different positions. Let's try this.
None
It
of
might
that.
have changed because,
Yeah.
like you said, once you went to the dentist, he was able to latch there, but then because you just hadn't been doing it, it was the bottle, it
Yeah.
was just easier to maintain that for
Yeah.
you.
And then he got
So
used to it as
having
well, right?
exactly.
Yeah.
So having that support is so important, whether it's in the hospital through your nurses or with lactation specialists in or out of the hospital.
Yes.
But I just hear that way too often where moms do not receive enough breastfeeding support in the hospital.
Yes.
And
I've
that
also like
happens,
from
yeah.
friends' experiences. Especially with my daughter, the lactation consultant came in, and I don't want to bash hospital lactation consultants, but I think that they have so many patients, and they kind of just give like the same spiel to everybody. Because then when I was in the NICU room, she
Mm-hmm.
was in a shared room. she gave the exact same spiel to the lady beside me, which
Yeah.
is fine.
Yeah,
But at the
yeah.
same time, it's like every situation is kind of different, right? Like I had
Totally,
no
yeah.
problem like with milk. Like I called myself the human cow because I had so much. Like I had enough stored for him in the freezer until he was 9 months old. Like I
Wow.
stopped doing it, so my milk supply like completely dropped as soon as my period came
Oh,
back, which
wow.
was at 3 months with my daughter and 4 with my son, and it was
Oh,
gone
okay.
within like a week.
Oh, wow.
It's crazy, but
Yeah.
I had pumped so much, and because I was supplementing with formula, I wasn't using it all,
Right.
because I was mixing it. I had enough left for my son until he was 9 months, so I
Oh,
had so
wow.
much. Um, but I've heard like girlfriends who have had that experience where they're like, yeah, like lactation consults in the hospital, like they said this, and then they hired private ones to come to their home, and they're like, it's a night and day experience. So
Yeah.
part of me
Yeah.
wishes that I did that, especially with her too. But I think because she was such a weakling, and like I said, I enjoyed seeing how much she was getting because that was part of
Mm-hmm.
like my anxiety too, to make sure she
Yeah,
was
no, for
feeding
sure.
enough.
That really
Um,
helps when you are worried because it's so hard.
yes.
Like you don't know if they're getting enough. Like with when you're
It,
just breastfeeding, it's a lot
Exactly.
of,
It,
a,
and, and
yeah,
and I remember in the hospital and I said that I was like, well, how will I know if she's getting enough? They're like, well, you'll just know. You'll be able to feel it. I'm like, I've never done this before. Like, what does that
totally.
mean, right?
Yeah. So
So
usually, like if your baby is having wet diapers and a certain number of diapers per day,
yes,
that's usually a good indicator. And then there's like other signs to look out
yes.
for dehydration. But
But
it's
even
hard as a first time mom. Yeah.
exactly, and even with my daughter, like I said, I had to force her to eat. And it was kind of like, okay, like a little bit more, a little bit more. And she would like push the
Yeah.
bottle away, like she was done. Whereas like my son, he was like, I'm still hungry. Like,
Yeah.
but I had to
Yeah.
buy bigger bottles for him because
Totally.
he ate so much.
Yeah, every
So,
kid is so different, and
so
that's something
different.
as well. Like, textbooks teaches us this one way, but every baby is different.
Yes.
Their curve is going to be different, how
Yes,
much appetite. So as long as like you have to just get to know your baby and see what's normal for your
absolutely.
baby, because if you just go by the standard for everything and what your neighbor's kid did, you're just going to be
And
stressed out the entire time.
and that was I didn't actually talk about my daughter's like milestones and stuff and how behind she was on them, but I call my son my textbook baby because he was
Yeah.
like on the dot with everything and he was so easy and he did this and this and that. Like if you looked in a textbook and look at him, it was like, okay, he is a textbook child.
Yeah.
Whereas with this one, she was the only milestone she did on time was sitting up. She sat up, I think,
Mm.
like 4 days after she turned 6 months. And then
Oh.
everything else was, oh my gosh, I didn't actually touch upon that. She didn't crawl until she was 13 months.
Mm-hmm.
And she didn't walk until she was 19. So, and
Yeah.
especially having friends that had babies at the same time as me, it was really
Mm-hmm.
hard for me because all of them were doing all of these things and
Totally.
some of them were
Totally.
walking and running and she wasn't even crawling yet. And there
Yeah.
were so many,
Yeah.
like, I remember my best friend, our daughters are 4 weeks apart, and she had sent me a video of her daughter walking, like her first steps. And it was before she had turned 1 and she wasn't crawling yet. And I just remember bawling myself.
Oh.
And you want to be happy for
Yeah.
your best friend. So
Yeah.
then go,
Yeah.
oh my gosh, like my kids don't even crawling. What's wrong with her? So I
Yeah.
did end up going to physio with her because so my brother has cerebral palsy. So there was like signs, but it wasn't that,
Yeah.
right? Because my mom was like, I know
Mm-hmm.
what to look for and it's not that.
Yeah. Yeah.
Um, and she would walk like a champ when you held her hands,
Yeah.
but she just wouldn't let go. And as soon as she
Yeah.
would let go, she would just fall.
Totally.
So
Yeah. But she just needed to do it on her own time, right?
exactly. And it's so hard to
Yeah.
hear that as a first time mom because they're like, no, there's
Yeah.
something wrong with my kid,
Exactly.
right?
Of course. It's
But
so
she would,
stressful. Yeah.
and I think just her being an early baby, she was just behind on
Yeah.
her. So
Yeah.
she was when she was born, she was technically like a 32 weeker.
Yeah.
So she was
Yeah.
0 percentile when she was born.
So she really needed like, weeks to make up for it. And that's why her
Yes.
development was different. Yeah.
And you know what? I can really see that because even like having her be like technically like 8 weeks behind, I see that difference of like how it pushed everything. And I was like, oh, well, she's 8 weeks behind in this. And like you could really tell like how long it took her to catch
Yeah.
up. And you
Yeah.
see some babies that are preemies and it has no effect on them versus on her,
Mm-hmm.
it really did. And
Yeah.
especially
Yeah.
that she ate solids great up until the age of 1, but bottle feeding in the beginning was a struggle. Like it was like, hey,
Yeah.
this child.
Yeah, yeah. Some babies are just so sleepy, especially when they're so little. They
Yes,
can really struggle with the
she was one
feeding.
of those. Yes,
Yeah.
yes. And
Postpartum. is
Yes.
not easy, and
No,
depending
there's
on
so
the
much
baby
to
and the
learn.
situation, there is so much
I
that can
know.
come up, and it never ends really.
I
All the
know.
different issues that can come up and be
So many.
stressful.
And things that you didn't even know exist until you're in
Yeah,
it.
totally. That's why it's so important. I say this every episode, to have community and have girlfriends and friends and family. And if you're someone that doesn't have kids yet, support your friends who do, who are
Absolutely.
pregnant, and surround yourself with women who can support you
Yes.
for your pregnancy and postpartum, because it really does take a village. It's so essential.
I tell myself that I am the luckiest girl or early, like first time mom because there was four of us that had kids ranging from end of March till end of June. And I honestly, I don't think I would have been able to do it without them. Aside from like family, but having friends that were all in it together and like being able to
Yeah.
compare, which was good and bad in itself, but it was also like raised awareness about certain things and like just kind of preparing myself for being like, okay, or like, what did you do? And we did this and we did that. And that
Yeah.
saved me. I had my
Yeah.
son, I had one friend that had a baby around the same time, but it was different. But with my daughter and being a first time mom and not knowing things and having friends in the same time was life saving. Like I tell
Yeah.
people, I'm like, if you're gonna friends with a baby, do it. I highly recommend.
Yeah, it really helps, huh?
It's
That's
very
awesome.
lucky. Yeah.
Yeah, that's so good.
Yes.
And I just want to touch on, you mentioned the hospital lactation specialist. I think it varies so much. I've seen like amazing lactation specialists,
Yes.
but then sometimes you'll have one covering for the permanent one. Like everybody can have slightly different ways
Yes.
of teaching,
Yes.
and there it's so limited. Usually they'll have one, and it's usually just like from like 8 till 4. Like they're not there 24 hours the way the nurses are, so
Yes.
they're having to go see all of the patients, and they have like few minutes. And like we were just talking about the whole postpartum education, you're kind of out of it, you're not really taking it all in. It
Yeah.
really takes days of trying to then be like, wait, what were you saying again about that? So
Exactly.
having a lactation specialist after the hospital is a must. And
I
sometimes you can
agree.
get it through like OHIP, sometimes you have to go through like private ones,
Private.
but
Yes.
it's essential. Like it really makes a difference if you are someone who's struggling. Highly recommend
I,
doing
I
that.
I agree. And like I said, like the whole spiel thing, it's like that's it because they have so many other moms to see that they just
Yeah,
gotta go through quick and they kind of tell you like the basics, but it is
right.
difficult to take all of that information in the beginning, especially like when you're so
Exactly.
out of it and so much else is
Yeah.
going on.
Yeah,
So
totally.
yes,
Yeah.
yes.
Well, amazing. Well, thank
Yeah.
you so much, Nicole. I'm just
Yes,
going to
thank
ask you
you.
before we finish off if there's any advice that you'd like to share for moms who may be listening or future mamas.
Oh, I feel as if I could cry thinking about postpartum because it's like the most magical but hardest time on this
Yes,
planet.
it's very bittersweet.
Oh, it's the most bittersweet thing on this planet, and I would like every time my daughter reached a new month, I would like mourn her not being so little anymore. But
Yes.
it just gets better and better.
Yes.
She's almost 4, and I don't know how we got her. I'm
Oh.
literally gonna cry. But it's
I
just the
feel
best thing
you.
in the world. I know it's
It
amazing.
really is.
I love. There's like the hardest days, and it's wild, but it's the best thing
Yeah,
ever.
it
It's
is
so
wild.
hard, but
It
they make
is.
it worth it, right? Because you guys are
It
so
is. It's
cute.
insane, and it's like you have to experience it to understand, because it's like
Yeah,
it's so hard, and some days you're just like,
it's.
what the heck? But then it's
I
just like,
know.
I want more of this. This is
I know.
amazing.
I do remember one of my girlfriends when she had a baby, she kept calling him the baby. And I was like, he has a name. Like, why are you
Oh.
calling him the baby? And I think with my daughter, when I had her the first month, I was like, the baby, the baby, the baby. Because it's so crazy to think that you made this little tiny human that has a name. And so yeah, that's my one thing. I'm like, if it takes you a while to get used to it, that's okay.
Oh,
Like,
my baby, when she was first born, I called her my niece's name. And I was like, come to Auntie.
yeah,
And then I'm like,
right?
wait, no, I'm your
I'm the
mom.
mom.
And then like my husband also like like a few days later, he also called her by my niece's name, because like they're very close in age. But we
Yeah.
weren't used to like, oh no shit, like we're the parents.
We're the
Like no, we're not
parents. Yeah.
babysitting.
Oh
Like
no,
she's ours.
I know, and it's amazing. It's just it's so
Uh,
so hard. And like I said,
yeah.
I think if I could give one piece of advice is there's support groups for everything. You just need
Yeah.
to find them, right? And
Totally. Find
I
your
didn't.
mama groups.
Yes, yes. Even just like Facebook groups, join those.
Yeah,
Like
yeah.
ask questions. Like I
Yeah.
feel it's not embarrassing at all to ask any questions,
No.
and just do what works for you.
Totally.
Like
If you don't have
everyone has,
friends and family, find these community groups
yeah, there's
like
so
Facebook,
many.
WhatsApp groups. Yeah,
Yeah,
it's
there's so
important.
many, and it really helps. I think having that community is really what got me through, and I've made stronger friendships. I've lost friendships because of it, but I think it's just, and everyone's in a different stage of their life, but like having
Mm-hmm.
those mama friends, and I've had friends that don't even have kids who were just like rock stars for me and would come
Yeah.
and bring me breakfast and watch my baby while I could go nap.
Oh,
And
nice.
it's just,
Yeah.
it's the best thing in this world to have your strong group of friends and just someone to
Totally.
talk to too. Like those
Yes.
2 a.m. texting is so important to have with your
Yes,
friends.
it
And
is.
if you buy stuff
Yep.
on Amazon during a night feed, that's okay. Like
That's
getting
okay.
that package in the morning is
Yeah.
like, yes, I got through the night.
Essential. That's right. And
Yeah.
yeah, like you were saying, everybody's at different stages in their lives. And sometimes you can have amazing friends, but they might not be at the same stage. So
Yes.
sometimes just finding someone who's at that same level that also has a
Yes.
newborn or a young child,
Yes.
like, it can be
It,
really
it
nice to
helps.
connect. Yeah.
It helps so much. Like I said,
Yeah.
I don't think I would be able to get through it. And like even just being like, I feel this way today. Is this normal? It's like, yes, it's
Yeah.
normal. Like you're
Yeah.
allowed to not have a good day. And
Yeah.
the things like
Totally.
media makes it seem like, oh, like you're a mom, like be happy all the time. It's like, no, I don't
Yeah.
have to be happy all the time. It's hard.
Yeah, it's
Yeah.
hard and it's
Yeah.
amazing and it's everything and it's all
Yeah.
over the place and it can be 100 things in one day, but
Exactly. Exactly.
it's
Yeah.
awesome at the end
It's
of the day. We
amazing.
wouldn't
It
change
is.
it for the world.
No, I would never. I know they're the best.
Yeah, well,
Yeah.
thank you so much. It was a
Thank
pleasure. Thank
you.
you for
Yes.
sharing your stories. There was
Thank you for
so
having
much
me.
knowledge and like really good insights on so many different topics that we briefly touched on, but I'm sure it's going to be so helpful for the listeners. So
I
thank
hope
you.
so. Yeah, no
Thank
problem. Well,
you.
thank you so much for having me
you.
on. Yes. And
Bye,
we will
cutie.
chat later. Yes. Can you say bye-bye? Say
Bye. Sorry for taking your mama's
Stubborn
time.
girl.
She's all
I
yours
know.
now. Thank you so much for tuning in to Birth Unboxed. If you've enjoyed today's conversation and want to hear more, please consider subscribing to the podcast so you never miss an episode and leaving a review. I'd love to hear your thoughts or even your own birth stories, so feel free to connect with me via Instagram at thebirthunboxed.podcast or through my website linked in the show notes. Until next time, friends.